Hello, and welcome to our Coronavirus Safety Training webinar. The purpose of today's presentation is to provide general safety training for employees on the topic of coronavirus or COVID-19. And as you can see from our title screen, this is all going to be done through the lens of the Department of Labor and Industry's emergency standard. So without further ado, it's important to realize that there is a new Department of Labor and Industry standard that's been recently issued. Governor Northam announced the adoption of this as a statewide emergency temporary standard. It actually went into effect on July 27th of 2020, and this applies to all employers in the state of Virginia. So this applies to us as employees of VACORP, and it also applies to all of our members as well. And it's basically designed to address the threat of COVID-19 that we've been dealing with. And as part of the standard, there is a training requirement. So we figured we'd just kind of knock out two birds with one stone here. Yes, we want to provide safety training to our employees on the topic of COVID-19, and it is also something that's required. So we're going to knock out both of those things here today. So part of what the standard says is we're required to train on the standard itself. So I'm going to give you just kind of a brief introduction or overview of what the standard says. We've also got to hit on the anti-discrimination provision in the standard, and also talk about the IDPR Plan, or the Infectious Disease Preparedness and Response Plan. And I want to point out and pay special attention to the fact we actually will not be able to address that here today in this presentation. So part of what the standard says, and again, this applies to all employers in the state of Virginia, that says we have all got to put together an infectious disease preparedness and response plan, and we also have to train all our employees on that plan. But of course, we don't have access to all of your individual plans, so that'll have to be done on a case-by-case individual basis. We won't have the opportunity to go through that here today. So, rest assured, if you're not sick and tired of hearing about COVID quite yet, you've got more training coming down the pike before too long, because that training actually must be done really by the end of September 25th for that. So in addition to training on the standard, we'll also kind of pivot and do some general safety training on the topic of COVID-19. We'll talk about just the general characteristics, symptoms that you see, risk factors that increase, negative health outcomes, safe work practices, PPE as well. So that's just a little bit of a roadmap of where we're going to be going today. Before we get too far into it, just as a general note here, the purpose of the standard is not to conflict with any of the requirements or guidelines that have already been set out. It's very difficult to keep up with what we're seeing in the regulatory environment, because this is just kind of changing on a daily basis, and it seems like we're getting new guidance all the time from CDC or the Virginia Department of Health or VOSH. And essentially, this is not supposed to conflict with any of those things, but rather, in a lot of ways, it is designed to kind of supersede it. So what they're saying is, where this standard is the most stringent thing out there, you're going to want to follow it. But if the CDC or VDH has guidance out there that's telling you to do something that's a little bit more strict than the standard, well, then follow that. So when in doubt, unfortunately, it's saying, take the high road, take the harder road with it. But all that to say is the CDC guidelines, if you've been paying attention to those should all still apply. And this will all be happening under the purview of VOSH. That'll be the enforcement arm. So as far as, fines and things of that nature from deviating from the standard, those would be administered through VOSH like any other VOSH violation would be. And part of what the standard gives us is a requirement to have hazard classifications for every individual employment position. So employees are going to fall into different various hazard classifications based on the risk of exposure that they have to the SARS-CoV-2 virus. So as you can see from the pyramid here, there's going to be 4 different categories of essentially risk of exposure: very high, high, medium, and lower. And those classifications don't apply strictly just to the employer at large. What I mean by that, it's possible for a single organization to have various employees who fall into different hazard classifications. So it's just a brief example here. The standard explicitly lists school settings, on-campus educational settings, as what they would consider to be a medium risk environment. But that doesn't necessarily mean that all of the employees of a school would necessarily be medium risk employees. You could have your central office staff that could be potentially classified as lower hazard if they're able to completely stay away from other people and keep physical distancing and some of those other requirements in place. And on the flip side of that, you'll also have people in various positions like a school nurse that would be considered a high risk or high level of risk of exposure position. And really the way that they're planning to determine the classifications is just taking a look at the job tasks that are being undertaken, taking a look at the work environment, whether you're working indoors or outdoors, and looking at the presence of known or suspected people who are again, known or suspected to be positive for the virus itself, looking at the number of employees versus the size of the work area. So, it's possible that you could have two different employers who are working in the same type of business. And on one hand, you've got just a handful of employees spread out over a couple thousand square feet of space, and a couple others that are, on the other hand, you've got others that are working on top of each other, so to speak. You can run into different hazard classifications, even if the job tasks are relatively similar on that front. So working distance between people as well, duration or frequency of exposure, and also taking into account some of the other, extenuating circumstances. Things like, do you have shared transportation? Is that a common practice? Do you do ride shares or things of that nature? So all of these things are going to be taken as a whole to determine that hazard classification level. So we don't want to go too far into the weeds on this, but it is important to just understand how that works from a general overview of the standard here. In delving into these classifications a little bit more deeply, the top of that pyramid is going to be the most restrictive, fortunately. So it's unlikely that most of our members will have anybody in this category simply because it is so restrictive. Here we're looking at basically three different things that are going to fall into this category: autopsies, collecting and handling specimens from people who are known or suspected to be positive for the virus, and then various different types of aerosol generating procedures. So intubating, cough-inducing procedures, some dental procedures or exams as well. But really that's it. So anything outside of this is not going to be falling in that very high category. So essentially what we're really looking here are specific medical and laboratory settings where you're working pretty intensely with the virus or suspecting to be. High is going to be more what we're going to be seeing for a lot of our public safety folks, our first responders. They are actually considered to be high risk if they're providing healthcare or working within 6 feet of known or suspected infected persons, which is pretty likely, right? That there's a chance that you're going to be responding to something. You don't necessarily know if the person is positive or not, so you've got to kind of treat it as if you're suspecting that they are, sort of thing. So it's going to include things like our healthcare workers, first responders, as we said before. Also is going to include things like outpatient medical services, clinical services, drug treatment programs, dental care services, nursing home care, assisted living care, things of that nature as well. And moving down the list, looking at the medium hazard classification, here's where we're talking about more general working environments such as schools, correctional facilities, banks, restaurants, retail stores, really any type of working environment where there's an expectation that at some point you may be working within 6 feet of other people, not suspecting them to be positive for the virus, but you just have to be within that range with other people. That's going to be considered a medium risk environment. Interestingly enough, everything that we saw in the high classification, it's outlined in the standard that if you got your first responders and they're not working with people who are known or suspected to be positive for the coronavirus, they would be considered in that particular event medium risk. The problem there is, you can't really guarantee that's going to be the case every time. You probably don't have a first responder who's not going to take any calls if you're suspecting someone to be positive for COVID. So I just thought it was interesting that they took the time to explain that in the standard and mention it, because I think you're going to be better off probably defaulting to the higher level of risk classification in that case, rather than putting it in medium. But that's the way that they've kind of listed that verbiage in the standard. And finally, our lower hazard classification is going to be referring to places where there's minimal contact with other people. You never have a need to work within 6 feet of others. And really, so what we're looking here is some office settings. And I say some because even still, it's probably likely you'll have to modify those layouts that you're not coming into contact within 6 feet of other people. And in that case, it would be considered a lower risk of exposure in that category. Important to point out, in this case, there still might be other people who are infected. They're just not known to have it or suspected to have it. But it's still possible you could be working around other positive cases, and it could still be considered a lower risk of exposure classification. But again, that's because we've modified layouts and you're staying at all times outside that 6 feet of physical distancing. And I'm not going to spend too much time on the employer side of things simply because this is designed to be for our employees. But again, it is important to be aware of some of the things that are required of employers during this time of this temporary emergency standard being in place, looking at the new upcoming school year and all that fun stuff. You're going to probably see some changes out there. So some of those requirements include the need to create a HIPAA compliant system for reporting known and suspected COVID cases. So again, anytime you're experiencing symptoms or you've been exposed, there's an expectation you'll be reporting that to your employer. And of course, they're going to try to keep that as discreet as possible while still moving you through that system and taking care of it. You're also going to see them probably implementing new engineering controls and administrative controls, in addition to, depending on the position, providing the necessary personal protective equipment or PPE for the job task that you're doing. So what we're talking about here on the engineering side is you may see things like barriers going up or those modified layouts that we've talked about. On the administrative side of things, you're going to see probably new practices being put in place, things like physical distancing. Maybe you're marking off areas on the floor so people aren't getting into people's personal space quite as much, restricting or maybe completely eliminating some of the common areas, restricting the access to those areas, places like lunch rooms, break rooms. You'll probably see some increased remote workers. Maybe you'll see new shifts emerging just to keep people out of the same space at the same time a little bit more. You'll probably see some changes in cleaning and disinfecting procedures. Also hand washing and sanitizing. You may see more hand sanitizer stations going up around the office and ensuring that people do have access to hand washing facilities. And we'll get into the PPE side of things as well as we move along. Again, I just want to reiterate this as well, just because we do not have the chance to address this, and you will have to have some training on this as well. But as we said before, the standard does require you to implement an infectious disease preparedness and response plan, and not only to implement that, but also to provide training on that. They gave a 60-day lead time on that. So, depending on when you're viewing this webinar, regardless, it's not a ton of time, but all of this trainings must be completed by September 25th at this point. And again, we do not have the chance to do this training here today. We also need to touch base on, as we mentioned before, the anti-discrimination provision outlined in the standard. And this is a pretty straightforward piece of the standard. Basically what it's saying is you have permission, of course, to adhere to this standard. You can follow this, you can raise concerns, safety concerns, you can refuse to work if you feel unsafe, make your concerns known to management really without any fear of retaliation or reprisal. They can't take disciplinary action against you simply because you're following the standard. And by that same token, they can't force you to do something outside of the standard and say, hey, I've noticed you've just been a lot slower because you're wearing those gloves that you're required to wear. Why don't you take those gloves off so you can do it a little bit more quickly? Again, you are allowed to adhere to the standard, right? Interestingly enough, you also have the opportunity to provide and wear your own personal protective equipment as long as it's not going to create an additional hazard for you or others around you. So there might be cases where, depending on your hazard classification level or the job task that you're engaged in, after doing a hazard assessment, your employer might say, okay, this is the PPE you need for this particular task, or maybe you don't need any at all. And you may be thinking, I'm a little nervous about this, more nervous about this than the average person. I'd really feel a whole lot better if I could, dress up in the full hazmat suit like we see in the picture there, or at least, wear my own gloves or something like that. And you're welcome to do that. You can bring in your own personal protective equipment and do that, as long as it's not going to interfere with your safety or the safety of others around you. So that, in a nutshell, is just kind of the general overview of the standard itself. Now we're going to kind of switch gears and get more into the characteristics of the virus here. So as you can see here from this slide, there's several different terms out there that you've probably heard before, might be familiar with, talking about COVID-19 or coronavirus, whatever you're familiar with hearing with it. But according to the World Health Organization, coronaviruses, plural, are actually a large family of viruses that cause illnesses ranging all over the place, from the common cold to some things that are much more severe than that. And you've probably heard of this year, referred to as the novel coronavirus, because it's novel, it's new, we haven't really seen it before, and the virus itself is been named the severe acute respiratory syndrome coronavirus 2, which is why you sometimes hear SARS-CoV-2, and the disease has been called coronavirus disease of 2019, which is why that's often shortened to COVID-19. So we've got a situation similar to what you've probably seen with AIDS or HIV, where HIV is the virus that causes the disease, AIDS. It's a similar thing that we're dealing with here. SARS-CoV-2 is just the name of the virus. COVID-19 or coronavirus disease is the disease. Oftentimes these things are used interchangeably, and we all typically kind of know what we're talking about. But I just want to make sure that you are familiar with the classifications and terminology with it. And essentially, as far as the virus transmission routes go, it's believed to spread primarily from person to person through respiratory droplets in the air. You might remember back when people were a lot more concerned about surfaces. You'd hear stories about the UPS man dropping off a package and people leaving it to sit in their yard for a week before they wanted to touch it, or maybe kicking it into their garage so they didn't have to touch it. And we've moved off of that a little bit here. I don't want to move completely off it, because as you can see here, there's still that fear that we might be able to also get it by touching a surface or object that has the virus on it, and then by touching your nose or mouth or face. And so we certainly want to be taking the cleaning and disinfecting of surfaces seriously, but the primary route is believed to be spread mainly from person to person through these respiratory droplets, which is why you've seen the guidance come out the way that it has, where they're saying, stay away from people, keep that 6 feet of distance, because you're much more likely to get it if you're in close contact with someone who's positive. And so that 6 foot cushion that we've been hearing about, is there anything necessarily magical in 6 feet exactly? Is it possible someone could sneeze and send those droplets a whole lot further than 6 feet? Yeah, of course. But, in the typical respirating or breathing here, you're going to be much safer outside of that 6 foot range, which is why that's kind of emerged as the standard there. And also, we need to point out the fact that there's no vaccine currently available for COVID-19. So the best way to prevent the illness, of course, is to avoid being exposed to the virus altogether. As far as symptoms go, this is a tough area because the symptom list is pretty exhaustive at this point. It's a pretty comprehensive list. We started out with a fewer than what you can see here, but as time has gone on, more and more has gotten added to the list. Nausea and vomiting, diarrhea are kind of more late arrivals with it, but there's a whole lot of stuff on here. The stuff at the top of the list, the fever, the cough, shortness of breath, those are typically the most common symptoms that have been emerging with this. At the bottom of the list there, with the nausea and vomiting and diarrhea, those are much more rare, but could potentially be associated with the virus as well here. So the symptoms can range from mild to severe, and of course there's a whole lot of different ones, but there are a couple things that we really want to be paying attention for, looking out for. Things like trouble breathing, persistent pain or pressure in the chest, new confusion, inability to stay awake or wake up, bluish lips or face. All of these things could potentially be signs that someone is infected with the virus, and of course should seek immediate medical care for that reason. And I would argue, regardless of the cause, if you're having any of those symptoms, trouble breathing, chest pain, all that fun stuff, regardless of what's causing it, whether it's the coronavirus or not, that's something you certainly should be getting immediate medical attention for. And it's important for us to point out how these symptoms can manifest themselves. And this, in a nutshell, is why it's such a difficult thing for people to manage and for some people to take seriously and things of that nature, the symptoms can take between 2 and 14 days to develop. So you may very well have someone who's positive for the virus that's running around feeling great. He's felt great for the last 2 weeks, all this time being positive for the virus. And to make matters even a little bit worse, it's also possible for someone to be completely asymptomatic altogether, and they never get any of those symptoms, not even at day 14. They're feeling great the whole time. Doesn't necessarily mean that they aren't a carrier, that they aren't infected still. And that, in a nutshell, is why you're seeing so much of the guidance that we've been seeing of, treat everyone as if they're infected, right? Keep your distance, wearing the face coverings and all that fun stuff. So it's just important for us to understand how these symptoms can manifest themselves. We also need to discuss the fact that some people are at an increased risk when it comes to COVID-19. There's just been a pretty high correlation between age and the severity of the disease here. So unfortunately, the older we get, the more susceptible we are to having a pretty negative health outcome if we were to become infected with COVID-19. So children, by and large, as an entire group here, actually fare pretty well. It's probably not, the worst thing in the world for them to get. They're, not unlike the common cold or something like that. But the older we get, the more serious that condition can be. So there is a correlation there. In addition to just being a correlation with age, there's also a correlation with underlying health conditions and some pretty negative health outcomes as well. So if someone were to have cancer, chronic kidney disease, COPD, obesity, an immunocompromised state from an organ transplant, serious heart conditions, sickle cell disease, or type 2 diabetes, they certainly want to be very careful in avoiding this particular virus, because there already have been some pretty, documented negative correlations with this sort of thing. So I know we're pretty much inundated with information on COVID-19 these days. It feels like there's conflicting reports. It's hard to really know which numbers to kind of take seriously, and fatality rates and all that. But I think most sources still do agree, the age is a pretty strong indicator, as well as some of these underlying health conditions. Now, some of them are not quite as clear. Again, this is a relatively new phenomenon here. So these conditions listed on this screen here, they might increase the risk of a pretty negative health outcome, but it's not necessarily that we have any conclusive data. It just seems like it might just kind of work that way, right? We're looking at things like asthma, smoking, pulmonary fibrosis, things that are affecting the lungs. This is a respiratory disease, so it would stand to reason that, you might be a little bit worse off if you have one of these conditions to begin with. But again, the jury's still out, so to speak. We haven't really seen it play out quite the whole way. And you probably noticed the immunocompromised state also made it onto this screen. We had it on the last one when it was referring just to somebody who had an organ transplant. This is basically now the all-encompassing immunocompromised state. So maybe someone who is HIV positive or is on steroids that are suppressing the immune system, things of that nature, could play into it as well. So what should you do if you know or you suspect that you might be positive for COVID-19? Well, stay home if you're symptomatic, of course. That's kind of been the guidance from the start here, is to try not to expose other people to it. But if this is something that develops while you're already at the office, where you're in your workplace, and you start to have those symptoms, well, typically, or what should be happening according to the standard, is you should be given a disposable face covering to wear until you can leave the site, and kind of kept in isolation, or kept at physical distance from others until you can safely leave the site. And then at that point, they're really pushing that people work from home as much as possible, because in some cases, it's just going to take some time before you can actually get back to work according to this standard here. So looking at getting back to work, once you've established that you've gone home because you've had some sort of symptom, well, now how can you come back? And there's two different methods that you can get back into the workplace. One is just a symptom-based method. Maybe you've got a few symptoms of it, but you're feeling pretty good. You don't feel like you necessarily need to go seek medical attention, so you're not going to go get tested or anything. In that case, you actually have to wait at least 10 days since the symptoms first started before you can come back to work. You also can't have any new symptoms that appear during that time, or else it's going to reset the clock. And as part of those 10 days, prior to coming back, you still have to have at least 3 days where you have no respiratory symptoms or fever without using any type of cold or flu medication or some sort of medication that's going to reduce or cover up your fever that you have, the symptoms of that. So going to take some time on the symptom-based side. The test-based side will get you back to work a little bit more quickly. What it's saying here, though, is you have to get not one, but actually 2 different negative tests that are collected at least 24 hours apart. So you've probably seen guidance. We've gotten a lot of questions on this already. Well, the VDH says this or the CDC says this, and that's all well and good, and hopefully that will maybe at some point affect what we're seeing on the Department of Labor and Industry standard. But as we said before, the Department of Labor and Industry is saying, hey, you've got to adhere to what we're saying. You've got to kind of take it to the most stringent standard, between whatever you're comparing here. And so far, what they're saying is you've got to actually take 2 different tests. They've got to be at least 24 hours apart. So you can't have someone that says, man, I'm not feeling good, I'm going to go get tested. Oh, great, it's negative. I'm just going to go ahead and run that back and get another test right now just so I can knock out my 2 and go right back to work. Doesn't work that way. You've actually got to wait at least a full day before getting that next test. And even still, you still can't have any respiratory symptoms or fever without the aid of fever-reducing medication. And the difference here is they've removed that timing requirement. There's no constraint of for at least 3 days like we saw in the previous symptom-based method. But again, that's going to be part of the test-based method. You got to be feeling no respiratory symptoms or fever while you're not taking any cold or flu medication. You also have to have those 2 negative tests taken at least 24 hours apart before you can return back to your workplace. And some of the general guidance out there on protecting ourselves is going to sound pretty familiar to us at this point. So things like washing your hands, avoiding close contact, covering our nose and mouth, some etiquette stuff like covering coughs and sneezes, cleaning, disinfecting, monitoring your health, all going to be some of the common sense things that we've been kind of looking at since day 1 of this, but we'll delve into these a little bit more deeply here in these coming slides. So as far as washing your hands goes, we're talking about washing your hands with soap and water for at least 20 seconds, using hand sanitizer that has at least 60% alcohol if soap and water is not readily available, and then still avoiding touching our face if we've got unwashed hands as well. And hopefully it's kind of coming into focus why you're hearing all this about the 6 feet. Again, this is believed to be mainly spread through those respiratory droplets in the air. So if we can keep ourselves away from that range where people are breathing, we're going to keep ourselves away from those respiratory droplets. So maintaining 6 feet of separation from others at all times as much as possible. And in addition to that, because it's not always possible to keep that 6 feet of distance, you might be walking through a doorway or in a hall that's constricted, whatever. When in public, the guidance is going to be to wear a cloth face covering or some other type of face covering over your nose and mouth while you're out in public. And again, this isn't just to protect yourself, but again, to protect everybody else around you, because some people are asymptomatic. You could potentially be a carrier and not even know about it, or you might have been infected a few days ago and the symptoms haven't shown up. So keeping the 6 feet of distance, covering our faces as much as possible. Also covering your cough or sneeze. You might be working in one of those office environments where you are continually at least 6 feet away from the next possible person. Maybe you aren't required to wear a face covering. Still want to cover your mouth when you're sneezing or coughing, because obviously you're going to be sending those droplets through the air otherwise. Also, just don't want to touch your face in general, any of the orifices on your face. Theoretically, someone could sneeze on your hand and you're not going to have a problem with it unless you touch your face with it. You've got to give it a way to get into your system, into your body. So someone sneezes on you, go ahead and wash those hands, get out of the habit of touching your face with it and introducing the virus to your system that way. We're going to get into the cleaning and disinfecting here in a coming slide, so we'll just leave it at that. We want to be cleaning and disinfecting frequently touched objects and surfaces. So again, we're not touching them and then touching our face and contracting a virus that way. And then of course, stay home if you're sick. There's a big heavy emphasis being put on self-monitoring, because again, we don't know what everybody's doing in their personal lives when you were grocery shopping last and someone sneezed on you, or if one of your family members picked something up and you think you've been exposed to it. So we really need to be paying a lot of attention to our own symptoms, our own who we've been around, and really try to self-monitor and stay home if we're not feeling well, of course, except to get medical care, as it says here. So as we mentioned before, cleaning and disinfecting, we'll talk a little bit about that. When you're getting into the cleaning, if possible, you actually want to wait 24 hours if you're going to be cleaning an area specifically where someone was known or suspected to be positive for the virus was hanging out. Maybe you've got kind of an isolation room where you're putting somebody who's having symptoms before they can be transported home. If you don't need that room right away, you're actually better off from a safety perspective to wait 24 hours if possible. And the reason being, again, primarily this is an airborne through the water droplets type virus. If you let that place kind of air out for a day, we're not quite as concerned with what's going to be on those surfaces. So it's going to make it a little bit of a safer environment. But of course, that's not always going to be a possibility. So as far as cleaning and disinfecting goes, you always want to use an EPA approved product. You can find an EPA registration number on the product. You can check to see if it's on the EPA's list of approved disinfectants. They're aware of the pandemic as well, so they've been good about posting a list on their website, so you can find that there. Bleach is an approved product. If you're using on a 10-to-1 ratio, 10 parts water to 1 part bleach, that is an adequate disinfectant. Alcohol solutions can be used as well, as long as they have at least 70% alcohol in them. But as we said before, nothing in the standard is set to negate some of the other standards that we already have in place. Say, for example, chemical safety that's laid out in the hazard communication standard, things that we've been kind of paying attention to from an OSHA or a VOSH standpoint to begin with. All of that still applies here. So you've got to be reading, following the product directions. Chemical safety is going to be important with this. You got to have the safety data sheets available. Obviously, reading the labels before we're using the products, and following the labels, doing exactly what they tell us to do. Now, you may have noticed I've got cleaning and disinfecting as the title of the slide, and some people think of these things just kind of interchangeably, that it's a semantics thing and they both mean the same thing. But there actually is a difference between these two terms. Cleaning basically just means using soap and water to kind of reduce the germs and dirt and impurities, allowing you to get down to the surface. And the disinfecting portion of it, that's the portion that's going to actually kill the germs on the surfaces. So in some cases, you may need to pre-clean something or clean an object first before you can get down and get your disinfectant involved and disinfect the surface afterwards. As we said before, with reading and following the directions, follow the contact times. Depending on what solution you're using, it may need to sit on a surface for a certain amount of time before you wipe it off. So make sure you're paying attention to the contact time. And then wear your PPE. Again, this goes hand in hand with what we talked about, not negating the hazard communication standpoint. We got to be thinking about that personal protective equipment, not just to protect ourselves from the virus that could potentially be around us, but also to protect ourselves from the chemicals as well. So wear the PPE that's recommended for the product that you're using, and still wash your hands after removing gloves, just in case there is a little tear or something that gets in a glove and you might get some chemicals on your hands anyways. Still want to remove those gloves and wash your hands afterwards. And any special cleaning protocol that we're putting into place strictly because of COVID-19, we actually don't need to apply those standards if we're able to keep an area unoccupied for 7 days. So much like we saw in our first bullet point here, if you can wait 24 hours, you're going to be kind of doing yourself a favor, because if it's airing out a little bit, we're not quite as concerned about the potency of these surfaces. If something's been sitting vacant for 7 days now, we're not really as concerned about the virus at this point. You can basically, you can just clean it according to your normal cleaning protocols. You don't have to take any special COVID-related steps at this point. So we've been talking a little bit about the personal protective equipment at this point. And as we mentioned beforehand with those hazard classifications, your employer is going to be required to document the hazard assessment for each of the particular different job tasks that's going on or different positions in your workplace with a written certification. And they're going to address, as part of that hazard classification and hazard determination or assessment, they're going to address what PPE or personal protective equipment is needed for the various tasks that are going on there. So this could be a pretty wide topic depending on what people are doing, but for our purposes today, we're going to keep this pretty simple and just focus on what you will probably see as some of the more common pieces of PPE emerging from this. One being face coverings, stuff that we've been seeing a whole lot of before already. And the second, you're looking at the picture there, so you can see we're going to cover the gloves as well. But with face coverings, before we go too far into the weeds with it, I want you to understand that you can request a religious waiver or be exempted for safety reasons as well. So you may have heard, for example, that wearing a mask could increase the risk of heat illness or somebody overheating, which is true. So you need to be paying attention to what those symptoms could be. So symptoms of heat illness would be things like dizziness, lightheadedness, dehydration. So it's important for us to really try to stay cool. If we're going to be working outside around other people where we're wearing a face covering, maybe we want to try to start early when it's a little bit cooler. Make sure that we're getting plenty of water, taking breaks in the shade, that kind of thing to avoid heat illness. And you may see, as we mentioned in that previous bullet point, some people who are exempted for safety reasons altogether, or that can request a religious waiver. And then the second piece we'll take a look at, a little more straightforward, going to be the glove side of things. So you've heard me saying kind of face coverings the whole time. A lot of people are saying masks. We use that pretty interchangeably because it just makes a lot of sense. But technically, there is a difference between the two. A mask is actually a filtering respirator, like an N95, whereas a face covering is going to be like the little cotton, little cotton mask that you're putting on. It's not really doing any filtering. It's just acting as a barrier between you and the elements. That's going to be a face covering. So with face coverings, it's got to fit snugly but comfortably against the side of the face. Pretty straightforward there, right? If it's not fitting snug, it's not really creating a great barrier for us. But if it's not comfortable, you're probably not going to wear it for very long. So make sure that it's snug but comfortable. You want to secure with ties behind the ears or behind the head. It should be breathable. Again, if you're not able to breathe in this thing, it's not going to last very long. These things should also be laundered regularly. Again, we're wearing these things pretty often at this point. We want to make sure that we're washing them. You're getting them clean, and of course, replace them if they're damaged. They're going to wear out over time, especially if we're washing these things regularly. So what should you do as far as taking on and off a mask? How to don and doff it here? Make sure that your hands are clean in both cases. Wash your hands beforehand. Secure those straps, again, behind the ears or around the head. And even before taking it off, recommendation here is that you're washing your hands and still only touching those straps as much as possible. And then a couple other do's and don'ts dealing with wearing the face covering here. Of course, you want to wear it to cover your nose and mouth, like we've been talking about throughout this webinar here. Don't let it just hang around your neck or below the nose or loose off your chin, or we got that nice picture of someone wearing it on the top of their head as well. I like that they used a pretty angry looking model for this. I think it's kind of capturing the attitudes of most of us these days here. Might feel a little bit unpleasant, but this is where we're at, right? So there you have it. A couple of the do's and don'ts for the face covering, and getting a little bit more technical on the respirator side. Looking at the N95s, for example, you want to make sure you're doing a little bit more as far as a fit test goes with this, because this is a filtering device, meaning that air should be going through the filters and not seeping in from the sides of the mask. So when you're putting it on, cup the respirator in your hand, put the straps over your head, put your fingertips towards the bridge of your nose and slide down that metal strip there to make sure you've got a nice tight seal against your nose. And at that point, you want to cup your hands around the respirator and take a couple quick breaths in and out and see if you can find any air that's escaping from the seams there. Of course, that last picture across the top, pretty straightforward. Make sure that any other personal protective equipment you're wearing doesn't interfere with the fit of your respirator, or else it's not going to be effective. But speaking with the fit and making sure that it's nice and snug, that's why you've seen some of the guidance like we see in those bottom slides. Can't have jewelry or facial hair that's going to interfere with that seal. First picture there, of course, getting rid of a respirator if it's damaged or dirty. We got to be replacing those, and not touching it. Again, our hands get dirty. That's not really a problem. That's why we just go and wash them. It's not going to get in our system that way. But again, we want to avoid touching our face. And then by that same token, avoid touching your mask or respirator in this case as well. So moving on to looking at gloves, you want to cover open areas with a Band-Aid before putting on gloves. And this is the case whether we're talking about wearing gloves from a viral standpoint or from a chemical standpoint if we're doing some cleaning. It's just going to add that extra barrier protection there. Getting rid of damaged, ripped, torn, damaged gloves as quickly as possible. Big thing, we'll look at this on the next slide, but taking off the gloves, we still want to avoid touching the outside of the surface, right? The rationale here is we're wearing gloves because we're trying to protect ourselves from whatever's out there that we're touching. Well, not going to do you much good if you go ahead and touch the outside of the glove afterwards. So make sure that we're still washing our hands afterwards as well, like we talked about with the chemical safety piece with cleaning. We're going to do our best not to touch the outside of the gloves when we're taking them off, but we're still going to wash our hands after. So as far as taking off the gloves go, you want to grasp the outside of the glove at the wrist. Don't touch your bare skin with your hands, and just peel that glove off without touching it. Then at that point, you can just hold the glove that you removed in your gloved hand, and you want to kind of slip your hand inside the inside of that glove that's still remaining, and then pull it off inside out. And there, you're just holding the inside of the glove, and you can toss it away there. And as we said previously, you still want to wash your hands afterwards. So last but not least, as we wrap up here, I also did want to just briefly touch on a common question that we've been dealing with a lot here, which makes perfect sense. You know, here we are, we've been reopening stuff, people are getting back into their workplaces, and they want to know, you know, obviously the threat of COVID is still out there. So we want to know, you know, how's this going to be addressed under the workers' compensation system? You know, is this something that's going to be covered? Is it not? All that fun stuff. And I think it's worth taking a minute here just to explain a little bit about how this system works. Workers' compensation is regulated actually by state law under the Virginia's Workers' Compensation Act. So basically what that means is it's the state that determines the compensability of claims. So you might be thinking, well, this is just another insurance type coverage, just like anything else, like your property and casualty, your liability insurance or auto insurance. And depending on what insurance carrier you're going with or provider you're going with, well, they might decide differently how they want to provide coverage to you. And that's actually not the case with how it works with workers' compensation, where we can do that on the property and casualty side of things. And we do that. We write your coverages and all that fun stuff. It's actually the state that determines the compensability on this side. And so really every single carrier is required to adjudicate claims the exact same way. And what we've been seeing so far is that the Virginia Workers' Compensation Commission has thus far been treating COVID-19 as any other ordinary disease of life. So basically just like getting the flu or the cold in the workplace. And so what in layman's terms that's been translating to is chances are, at this point at least, it's likely that's going to be denied because it's putting such a high burden of proof on the claimant by making it an ordinary disease of life. So essentially what it's saying is whoever's submitting a claim like this, they've got to prove that they've gotten it at work. And that's tough to do if you're, you know, a living, breathing person who's operating in the real world here, because we have to go pump gas and we have to go get groceries and do this other stuff. That's not to say that this might not change at some point, but it does require a legislative change. That's not just something that your particular workers' compensation provider can provide for you, or you think, man, I don't like how they handle this, I'm going to go find a new one. Well, the new one's going to have to be statutorily required to handle it the same way. So I just want to address that briefly just because we have gotten a lot of questions on that. But I also want to point out we've got additional resources on the topic as well. If you're interested to see this Department of Labor and Industry standard that I've been talking about throughout this presentation, you can go to their website. They've got the entire standard there for your viewing, and they've got a couple resources as well. We also have more resources available at our website. We've actually put together a summary document of the standard, so you don't have to go and read the whole thing in the jargon that they have it in. We try to put it in a little bit more layman's terms and put it down into some more digestible bite-sized pieces for you if you're interested in seeing that. We also do have some resources to help assist you in coming up with your IDPR plan and implementing that stuff as well. So feel free to reach out to your member services or risk control consultant if you have any other questions. Feel free to check out the websites that I listed above. Again, I appreciate your time. Thank you for tuning in. Stay safe out there and have a great day. Thank you.